Yeah, so we do a case history. So we might ask them about, how easy are they seeing things in the classroom, distance and near, what sort of devices they use, how long they use them, what sort of activities that do they participate in that takes them outside. So what sort of sport and other things. We want to know parental history because your chances of developing myopia increased for every other direct family member who is short-sighted. So, you know, it's more risk with two parents than one parent, as an example. Um, uh, is that's probably the core questions. We're still short-sighted people are notorious at having poor near visual skills, even though they don't have visual symptoms at near distances as much as other people do. And so we need to sort of be aware of generalized visual dysfunction in addition to them maybe starting to have problems with their distance vision.
Hmm. Okay. And so you'd still do the typical eye chart test. Or,
Yeah, and that's probably the most obvious one that picks up the problem where they're no longer able to see 20/20 or 6/6 on the chart. And then that would then match up to their prescription. And so we do a prescription check and find that they need some minus lenses to restore good distance vision. And one of the mainstays of myopia control now is also looking at axial length. So axial length is the distance between the front of the eye and the back of the eye. So effectively, if we get the old model again, so from the cornea to the back of the eye here is the axial length. And so in myopia development, this eyeball grows longer. And there's a fairly good correlation between increasing levels of myopia degree and your axial length. So I could normally point to it. It normally sits about there, but someone in the practice has seen some myopic kids today and has taken the machine that we use to measure axial length. So that's a very important part of, diagnosing and then managing myopia afterwards.
that does require special equipment then to measure that axial length.
Yeah, look, you don't need it to find myopia because just distance blur and blur that's corrected by a minus lens is a fairly basic definition. But yes, if you're serious about managing myopia, ideally you are measuring axial length as one of the primary measurements that you use for treatment effectiveness.
And like, what is the youngest age like to really start testing for myopia? Like if I've got a child who's like 3 or 4, is that too soon to really be concerned about this?
So getting an axial length measurement at that age is difficult, but we would recommend getting a test around 6 to 9 months old, and that's just more for general visual development. Same thing around 3 years old. Now, the classic thinking is that at the 3 year old, we're really looking at things more like eye turns and lazy eyes and those sorts of things. But so certainly by the time you get to preschool, sort of 4 or 5 years old, you definitely want to be getting some measurements, particularly if there's a family history. There's some suggestion that if you've got most kids are a little bit long-sighted or hyperopic, and if you've got a lower level of that hyperopia compared to the normal, that may be considered a predictive factor that you might be heading towards myopia. And so it's good to have that as a baseline to kind of get a sense of, well, how much has it changed? I even saw my own daughter change within 9 months. She was reasonably hyperopic, and then 9 months later, she wasn't. So, these things can change quite rapidly. So having some sort of baseline measurements is particularly good.